I'm Todd Bivins of Bivins Orthodontics. I'm an orthodontist here in Great Bridge. We serve, of course, the people of Great Bridge, all of Chesapeake, as well as the Outer Banks, all of Tidewater, really. My first job, I was a landscaper. Started out just like anybody else. I cut my own yard. Next thing I know, my neighbor asked me to cut hers, and then before long, I had bought a riding mower and hired a couple of my friends from school to run the push mowers and weed eaters, and I was cutting entire blocks in my neighborhood. By my senior year in high school, I was taking care of a golf course and a couple other areas as well. It was a great job. When I was in high school, just outside of Richmond, my two main loves were sports and art, and I love art. It's always been a huge love of my life, and I do all the original art here at the office. I don't paint that often anymore. It's just that I have three small kids, and that takes up most of my night and weekend time.
While in dental school, that's when orthodontics really grabbed me, because the type of art that I do is photorealism, and it's basically you're recreating the look of a photograph as exactly as possible. And that's orthodontics to a T. You start with a photograph and you grid off the canvas, or you do something to plan the work exactly, and you execute it in as precise a fashion as possible. And that's what orthodontics is. You take a patient that comes in and they have an overbite, they have an underbite, they have a cross bite, they've got crooked teeth, whatever it is, and you have that vision in your head as to what you want that to look like at the end. And before you even put on the first bracket or Invisalign, whichever way you're going, before you start anything, you come up with a plan. How am I going to execute this? How am I going to make this overbite look the way that I want? How am I going to make this underbite look the way that we want? And you spend the next year, 18 months, 2 years or so following that plan. And it has just been a perfect fit for me. Been able to use the things I love the most every day.
I met Jenny when I was a dental student at MCV in Richmond, and she was at college at VCU. She was getting her degree in education, and we fell in love and got married. She moved up to Michigan with me to go to orthodontic school. While we were there, she worked two jobs to kind of help put food on the table, because being an orthodontic resident doesn't exactly pay the bills. And she was just there for everything while we were so far away from home. And came back, and she had kind of put her own education on hold while I finished up my orthodontic training. And she got 2 master's degrees when we got home. She resumed her education and got 2 master's degrees in different styles of education. I think one is lit and the other is in secondary education. And that helps in so many ways. Although she's not teaching right now, she works with the kids every day. She actually does quite a bit with the office as well. And she's an amazing person. I need her every single day. When I graduated orthodontic school in 1997, I didn't have practice to fall back on. No one in my family was a dentist or an orthodontist. I was a long way from the Richmond area, so I didn't have any family that would come in and support me. Didn't really know exactly how to get an orthodontic practice up and running and off the ground. And the smartest person I know, my wife, told me, if you take care of the patients, everything else will just fall into place. And that has sort of been my mantra every single day. And if you talk to almost every patient that I have, they'll let you know that there are days that aren't perfect, but I'm going to do everything possible for them. I'm going to take care of them. If they need that X-ray taken, I just take it. I don't worry about if the insurance company is going to pay me for it or not. I just take care of them. If they break that retainer, I talk to the lab and see if they can help them out with that bill. I do everything possible to take care of the patients, because at the end of the day, it doesn't matter how many magazines you're in or how many commercials you do, your patients are your best source of advertising, and if you keep them happy, everything else does fall into place, just like my wife said it was going to.